Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today, we're talking about lung cancer. Many people ask the same quiet questions. Why does lung cancer happen? Why did it affect someone in my family? And what should we do now, especially with all the new treatments people are hearing about?
These are important questions, and it's good to talk about them clearly, without fear.
Let's start from the beginning. What exactly is lung cancer?
Lung cancer is a disease where cells in the lungs begin to grow uncontrollably. Healthy lung cells follow strict rules for growth and repair. In lung cancer, repeated damage causes genetic changes inside these cells. They stop responding to normal control signals and continue dividing. Over time, this leads to a tumor that can invade nearby tissue or spread to other organs.
How common is this disease?
Lung cancer is one of the most common cancers worldwide. It is also one of the leading causes of cancer-related deaths. It affects both men and women. Risk increases with age, but younger people can be affected, especially with strong exposures.
Many people immediately think of smoking. Is that the whole story?
Smoking is the strongest risk factor. Tobacco smoke contains many substances that directly damage lung cell DNA. The risk rises with duration and intensity of smoking. Secondhand smoke also increases risk, but smoking is not the only cause.
So why do some people who never smoked still develop lung cancer?
Other long-term exposures matter. Radon gas can accumulate in homes and damage lung tissue over years. Air pollution contributes through chronic inflammation and oxidative injury. Occupational exposures such as asbestos, silica, diesel exhaust, and heavy metals increase risk. Some people inherit genetic susceptibilities that make lung cells more vulnerable. Chronic lung diseases with ongoing inflammation can also play a role.
When lung cancer begins, how does it usually present?
Early lung cancer often causes no symptoms. That's one of the reasons it is dangerous. As it progresses, people may develop a persistent cough, chest discomfort, or shortness of breath. Coughing up blood, unexplained weight loss, fatigue, or repeated chest infections can appear. If the cancer spreads, symptoms depend on the organs involved.
So how do doctors confirm the diagnosis?
Evaluation usually starts with imaging, often a CT scan. If a suspicious lesion is found, tissue is required for confirmation. This can be obtained through bronchoscopy, needle biopsy, or surgical methods. Once cancer is confirmed, additional tests determine the type and stage. This information guides treatment.
Before labeling it as cancer, what else must be considered?
Several conditions can look similar on imaging. Infections such as tuberculosis or pneumonia, benign lung nodules, inflammatory or autoimmune lung diseases. That's why a tissue diagnosis is essential.
Now let's move to treatment. People often hear that lung cancer therapy has changed dramatically. Is that true?
Yes. Treatment has evolved significantly. While chemotherapy and radiation are still used, we now have targeted therapies and immunotherapy. These newer treatments are based on the biology of the tumor itself.
Can you explain targeted therapy in simple terms?
Some lung cancers have specific genetic changes that drive growth. Targeted therapies block these abnormal signals. They act more precisely on cancer cells and often cause fewer side effects than traditional chemotherapy. Testing the tumor for these changes is now standard practice.
And immunotherapy?
Immunotherapy helps the immune system recognize and attack cancer cells. Some tumors hide from immune detection. These medicines remove that protection. For many patients, immunotherapy has improved survival and quality of life, especially in advanced disease.
So treatment today is more personalized.
Exactly. Decisions are based on tumor type, stage, molecular features, and the patient's overall health. Care is usually guided by a multidisciplinary team.
Now, let's talk about families. If someone has a parent with lung cancer, what does that mean for their own risk?
Family history can slightly increase risk, but it does not mean lung cancer is inevitable. Risk is influenced much more by smoking, environmental exposures, and lung health. Genetics may contribute, but they are rarely the only factor.
How should screening be handled in people with a family history?
Screening recommendations are mainly based on age and smoking history. Low-dose CT screening is recommended for people at high risk due to smoking exposure. Family history alone usually does not qualify someone for routine screening. However, if family history is combined with other risk factors, screening can be discussed individually with a doctor.
What about people who never smoked but have a parent with lung cancer?
Routine screening is generally not recommended for non-smokers based on family history alone. The focus should be on prevention and vigilance. Avoid smoking and secondhand smoke. Test the home for radon. Reduce exposure to air pollution and occupational hazards. Seek medical evaluation if symptoms appear.
If a family member already has lung cancer, what should relatives do now?
Support the patient emotionally and practically. Review personal risk factors with a healthcare provider. If eligible for screening, follow through without delay. Adopt lung-healthy behaviors immediately. And avoid blame or guilt. Lung cancer is a medical disease.
This can be overwhelming for families.
It can, but medical care today offers more options and more hope than ever before. Accurate information, early action, and compassionate support make a real difference.
Thank you for this clear and thoughtful explanation. Thank you for watching Dr. Health Hub. Don't forget to like, share, and subscribe for more trusted health education. And remember, your health is your wealth. Stay tuned for the next Doctor Tip you can trust.